Hello everyone. Today we're going to talk about back rehabilitation activities in the water. Stacy is our exercise model. You'll notice that she's wearing a green band tied around her chest area. You should strive for keeping yourself in water that is approximately this depth. Now, there are some things we want you to think about and focus on while you're trying to rehabilitate your back in the water. The most important thing is maintaining your body in excellent alignment. You want to keep your head, shoulders, and hips all directly on top of each other. You can imagine a helium balloon lifting your head up toward the sky to help maintain good alignment in your spine. Don't allow your shoulder blades and your shoulders to elevate up towards your ears. You want to keep your shoulders in a relaxed position. It's important to do all of these exercises slowly. This gives your weaker muscles and your less coordinated muscles time to catch up and do the activities you're asking them to do. You want to recite the mnemonic of heel-toe, walk slow, and think tall. When you walk heel-toe, this is how you should be walking in regular life. If you do this slowly, it will help your muscles train on how to do this for you. You want to walk slow and think tall. So the first activity that we'll do is walking slowly and walking heel to toe back and forth in the water for 3 full minutes. After you have completed this activity, you will perform your first back stretch. Stacy, I want you to perform the back stretch by pretending that you're holding on to the side of the swimming pool. Bring one knee up toward your chest and then pull your shoulders toward the side of the pool as you keep your knee against the side of the pool and stretch your back forward. Like you're going to bend down and kiss your hands. Stretch. And then come back up. Of course, Stacy does not have the pool to hold on to, so she's struggling with her balance. But you guys get the idea. You'll maintain that position for 5 seconds with one knee bent on the side of the pool, and then repeat the same stretch with the other knee bending forward on the side of the pool for 5 seconds. Then you will turn around and put your back and your buttocks against the side of the pool.
Okay.
As you put your back and your buttocks against the back of the pool, you're going to practice the tummy squeeze. Okay? With this activity, you will imagine a sponge full of water in your lower tummy area, and imagine squeezing all of the water out of the sponge to tighten your lower abdominal muscles. You want to maintain this contraction for 5 seconds and repeat it 3 times. Step 3 involves using this new tummy squeeze activity.
Go ahead.
You will take 3 steps, slow and heel to toe and think tall. On the 4th step, you will stop your steps, perform the tummy squeeze as if you're squeezing water out of a sponge in the lower belly area, and then you will proceed and take 3 more steps, stop, perform a tummy squeeze, and start taking your steps again. So it's take 3 steps, stop on the 4th step, perform a tummy squeeze, and then start again. You'll continue this activity for 3 full minutes. After completing this activity for 3 full minutes, you will repeat the back stretch against the side of the pool. This time Stacy's going to face the side of the pool and perform her back stretch. All right, and then come forward for 5 seconds. And then repeat this on the other side. Now she will proceed with the next activity, which is taking long strides and slow steps. Long strides. And still thinking about the heel toe, walk slow, think tall. You'll perform this activity for 3 full minutes and stop and repeat your back stretch on the side of the pool 1 time each leg for 5 seconds. Now the next activity is power walking. You'll take a step forward, bend your knees down and lunge down and back up, down and back up. Remember, walk slow, think tall, heel toe. We will do this activity for 1 minute when you're first starting the back rehabilitation activities. After you have done 3 full sessions of the level 1 of back rehabilitation activities, you will increase the time on your power walking to 3 full minutes. After you have finished this, you don't need to do a stretch again. You can immediately go to the cross-step walking or tandem walking. If you have problems with your hips, if you had hip surgery where you've been told by your doctor to not cross your legs, or you have severe hip arthritis, you're only going to walk heel to toe, like you're walking a straight line for a DUI test. I don't know if any of you have taken those before. Stacy might have. If you do not have hip problems, then you're going to cross over a walk like you're braiding someone's hair. There you go. Cross over walking. And do this one nice and slow. You don't have to think about heel toe on this one because it's really not practical. You'll do this activity for 1 minute if you've just started the level 1 back rehabilitation activities. Once you have completed 3 full sessions of the level 1 back rehabilitation activities, you will increase the time of the cross-step walking or tandem walking to 3 full minutes. Now this completes the exercise phase of the level 1 of back rehabilitation activities. After you've done it a few times and it becomes very simple for you, you can make it a little more challenging by starting to emphasize symmetrical arm swing with every step, really focusing on controlling your arm movement and have your arm movements coincide with your opposite leg movements. You can also try closing your eyes and see just how slow you can go and complete the movements with your eyes closed and good arm swing. This is very challenging for your body in the water, but it helps the slower muscles work better. It helps the weaker muscles work better. At the end of this activity, if you want to hang from a noodle for 5 minutes and let your back gently stretch, this would be acceptable. After you've finished hanging from the noodle, you will need to walk in the chest-height water for approximately 2 or 3 minutes before coming out of the water and having full weight come on your spine.